Hey guys, welcome back. I am at a remote location and we are live. I'm here to answer your questions, and I always like to say that anything that I say is not meant to diagnose you. It's for your own educational information, to do your own research. Check with your doctor before following my advice. And if you want to call in live, the number is 866-561-4292. Give me a call. And, today we're going to focus on extreme keto to get your body fat down to zero. I have a demo I'm going to pull up of, we call him Ribs. He lost a lot of weight and he's looking really good. So, Steve, can you pull him up to show people what you can achieve if you do extreme keto?
Well, there he is, and he's being quite quiet this morning. He was very lively earlier, but I think the final stages of keto may not have been a good, healthy effect for him.
All right. I can't see him. Can you pull him up?
He's up for your
Oh, he's up?
Stand by.
Okay, good.
Yeah, there you go.
Good. Yeah. Hey, you guys can look like that too if you want to do extreme keto. And it's basically intermittent fasting, fast for a year, and you're going to look just like this. Um, hey, listen, we got a lot of callers, so we're going to jump right into the first one. Mark from Charlottesville. Go ahead, Mark. You're on the line. I think you're on the line. Hey, Mark.
Yes, I'm here.
Hey, Mark. How you doing? You had a question about your set point. Go ahead.
Yes, I have a rather elaborate history, pretty significant diabetic, and I blew out my hip, and sort of was put out from work because my gait was unstable and such like that. So I'm sitting at the house going, oh my goodness, I got to have my hip fixed. Went to the ortho guys. Said, great, we need to do it, but you need to have your weight down to 275. At the time, I was 333. So I was talking with my wife, Della, who Dr. Berg spoke with a couple of weeks ago, and she said, well, why don't you try this this form of losing weight that this Dr. Berg is talking about? So this was back in February. Fast forward, this week I hit the 275 point. I've lost 50 pounds since February, basically using the intermittent fasting, and we're sort of at the 22-hour fasting, 2 hours of meal in the evening, and we continue to go on. I'm off of all of my insulin. I was 3 times a day before meals, and then 40 of Lantus at night. My endocrinologist has been blown away by my weight loss. We've taken me off of all of that. But getting to my point, the reason my wife got interested in your program was you were speaking of weight set points. And, I mean, I've been up as high as 380. I played football in high school and college between 215 and 250. I'd diet down and then bang back up. So my question is, once I get down to the point that I really want to be in, which is in around the 230 range, how long do I need to continue to work with the program so that my body resets and it says, hey, you need to be in the mid to low 200s, not the mid to high 300s?
Yeah. Okay, so here's a good question. So here's what I want you to do. In the very beginning, looks like you have some amazing results. You're doing some pretty good, serious intermittent fasting. So that's going to drop everything. If you make sure that you, being a diabetic, really are taking B1, B vitamins, benfotiamine. That's a fat-soluble B vitamin, nutritional yeast, because from all that insulin you've taken in the past, you want to protect the cells. And that's really what protects the cells against the damage that happens with all the high insulin. As everything comes down, you're off the insulin, hopefully the blood sugars are coming in here. Um, you should continue to lose weight, especially if you start adding exercise. Now you're going to get down to your ideal set point, your weight, where you should be. And at that point, a lot of people start continuing to lose weight and they get really, really lean, which is, they don't want to sometimes get that lean. So I recommend, instead of adding the carbs back, because that's going to create the same problem, increase the fat until you're stabilized. So basically, the fat will allow you to kind of tell you where you're going to weigh, because if you have a little bit more, then your body will stop losing weight and start using this as your fuel source. So that's really kind of a thing where you don't want to start increasing protein or decreasing protein. You don't want to increase your carbs. The variable is the fat. If you increase the fat, you'll slow down the weight loss and then you'll maintain. Adding exercise can also increase muscle mass, but it can also help you to speed up the weight loss too, depending on what kind of exercise you do. Okay?
Right. Well, I'm at 63 years of age, so I'm not going to be doing a lot of strenuous exercise, but it's definitely a new hip will help me get out walking and such like that.
Yeah, and then one last thing, because I have to go to the next caller. We want to make these short and sweet. Watch my videos on working on old injuries after surgery, what to do after you get the surgery. If you have it on the right hip that replaced, you want to have someone kind of do some therapy on the opposite hip, because that's the compensatory leg, and that will really help your gait be even, and you won't end up wearing out a disc. All right, thanks, Mark. Good luck to you. All right, let's go to Diane from Maryland. Marilyn, let's see, Diane, you had a question about following videos and doing keto severe leg cramps. Can you tell me more about that?
Yes, Dr. Berg. Thank you so much for taking my call.
Sure.
So I'm at my 50-pound weight loss. Today I weighed in it, which is amazing. I was diagnosed with fatty liver disease in the beginning of the year. So I did watch some of your videos. I was having some really severe leg cramps. Actually, it felt like my muscles all over my body and my shoulders and my legs, hips, lower back, mid-back. So I increased my electrolytes. I was doing 1 drink a day, and I went to 2 drinks. I'm taking a number of things. I can tell you what they are, but I'm really following the plan pretty strictly. I'm eating twice a day, 4 to 5 cups of vegetables in each meal, protein and fats in each meal, and taking all the things that you had said to do. So I am.
You just you went dead. I don't know what happened. So I'm assuming that you can hear me. So I'm going to just tell you what to do. So I would recommend increasing the potassium. You're probably already taking the electrolytes that I have, which has about 1,000 milligrams of potassium per serving size. So that would be the first thing I would jump to. Usually potassium and the magnesium in there should handle the leg cramps. If that still doesn't work, you may need more sodium. You need sodium, sea salt, because that's the other electrolyte. And then lastly, I would try the calcium. You might want to add calcium. I didn't put a lot of calcium in my electrolytes, but you can add that. Get calcium orotate, and that should take care of that'll bring you up to maybe most of the cases. On a rare occasion, you might want to add vitamin E to this mixture. Make sure it's natural, because a lot of vitamin E's are synthetic, and you don't want to do that. You want to actually have a full complex vitamin E, and then I also want to differentiate one little point about that. Sometimes people have leg cramps, but really they're describing tenderness in the calf. When you press on your muscles, are very tender. That is a B1 deficiency. So sometimes you need that as well. Last thing I'm going to say, and then I'll shut up. When you have, if you had a kidney stone, and this is interesting, a lot of people will all of a sudden they'll get these cramps in their calf, like really severe. It has to do with the stone coming out and irritating the ureters. But that's a completely different situation, in which case you need to drink a lot of lemon juice and avoid probably peanut butter, peanuts, and spinach to decrease your ability to decrease your formation of stones. All right. All right. Let's go to Nils from Colorado. Let's see, Nils, you're on the line, and um, you had a question. Go ahead. All right.
I got a really bad TBI. They sent me back to law school, and they were going to go ahead and start treating my TBI. And they also found out that I had multiple sclerosis.
Now, TBI.
So
What do you talk about TBI?
A traumatic brain injury. My vehicle blew
Okay.
up, and I hit my head in the ceiling of the inside of the vehicle and got knocked out and whatnot. But I'm wondering, because they had me take Avernex shots in my stomach. It didn't work out, so now I take infusions once a month. And I'm wondering, is keto something that I could get into? Like, would it be beneficial for me with multiple sclerosis or no?
This is a great question, Nils, and I'll have every time you ask a question or anyone asks a question, I'll have the producer pause so I can't hear you, but you can hear me, because that way I'm going to tell you what to do. Any type of brain injury is very, very, it's very beneficial to do keto, because you're going to actually cause something called neurogenesis. You can regrow your brain cells when you do the combination of keto and intermittent fasting. So yes, it's for the healing, especially the intermittent fasting, because think about it. MS, you have all sorts of destruction and antibodies that are going on to self-attack to your brain. And if you do intermittent fasting with keto, you're going to support directly not just the brain, but the immune system that's attacking it. I would also highly recommend taking something called DHA in large quantities, which is going to support brain injury. Lastly, since you've hit your head on the top of the car, go and watch my videos on injuries to the skull and the head after, I can't remember what it's titled, but I show people what to do after an injury. There's some acupressure for the skull itself that will give you a lot of relief. But a lot of times you can have injury to the brain, then it actually can develop into autoimmune. So that may have happened to you. But yeah, you need to do keto and intermittent fasting immediately to get the benefits. And I think you're going to be pleasantly surprised at all the results you're going to get from that. Yeah. Okay. DHA, take that. Thanks, Nils. All right, let's go to Utah. Her name, or his name, I'm not sure. It's Sishe, I think.
Cecilia?
Seshia. Okay, good. So you had a question about
Hi.
Hashimoto's. Go ahead.
Yes, I was just diagnosed about 2 years ago with Hashimoto's and also insulin resistance. And I've heard that with a ketogenic diet, it could affect your thyroid. And also I had questions on what supplements to take and how soon to start.
Got it. Okay.
I'm just starting this.
Okay, great. Thanks for calling. And then I'll have the producer can actually just put you on pause for a second. Okay, so here's what you need to do. Hashimoto's is an autoimmune problem more than even anything else. It's not just a hypothyroid, it's an autoimmune. So believe it or not, cruciferous vegetables are going to be very, very important, even though they'll say, oh, don't have cruciferous because it's going to deplete your iodine and your thyroid hormones. But if you take sea kelp with that, totally fine. In cruciferous vegetables, there's something called glutathione that is the absolute best thing for the liver and for the immune system, and it's going to help your thyroid. I would also recommend getting something called purified bile salts, or just get the gallbladder formula that I have that'll help you convert the thyroid hormone. So that way we can actually speed up the thyroid. And of course, if you have hyper, you don't want to take it because that'll speed it up too fast. But cruciferous is important. Sea kelp would be important to get the iodine, and selenium. The selenium is the really important vitamin for the thyroid, just as important as iodine, and because it supports the immune system. And lastly, No, it's not true that that intermittent fasting or keto will worsen the thyroid if you do it healthily. In fact, it's going to help your thyroid. What will inhibit thyroid function is the sugar and the carbs. So yeah, you need to do this exactly like I talk about in the book. This is a good book to get, which is a summary of it. Jump right in to get started, and then you can get the big book to kind of get all the details because um, you might need this, especially because the book is all about what to do if you have other problems in addition to just losing weight, which sounds like you do. Okay. All right. Well, thanks for calling, and let's go to the next caller. I think we're going to go to Steve. What should we go? Well, we'll go to Connecticut. Chronic blushing, not rosacea.
Hi.
Hi.
Hi. Hi, doctor. Can you hear me? Oh, good.
I can hear you perfect.
Yes, I have chronic blushing.
Okay.
It's chronic blushing. It's not rosacea. We had talked
Okay.
before. You had suggested that I, watch the ANS video, which I did, do the adrenal massage, go to one meal a day. So I am doing keto, intermittent fasting, taking the adrenal support. I'm not seeing any movement, and they want to cut the nerve in my spinal cord. Just don't want to go that route.
Yeah.
Anything
So
else
can I ask
that
you
you
a
can think
question?
of?
Um,
Yes.
when did this start? When did this start?
I cannot tell you. It's been so long. I don't remember having it as a kid, but as a young adult, I remember it coming on. But no,
Do you,
nothing traumatic.
what
Pretty
about it
normal
as
life.
a teenager? Did you have it as a teenager?
I don't remember having it as a teenager. I'm old as crap,
Okay.
but I don't
All right.
remember it.
And is it just in the face, or is it other parts of
Just
your
the
body?
face. Nope, just the face. And if it gets really bad, I will start to sweat underneath my armpits. But usually
Yeah.
it's just, nonstop throughout the day. Nonstop. With
So
anyone,
it's,
family, friends, an animal, a dog, a child, doesn't matter.
so is there anything that triggers it more than other things?
Being awake,
Wow.
it's all the
Wow.
time. It's all the time.
Yeah. Well, okay. For this situation, um, the way I try to, when you have something really chronic and really complex and you can't quite figure it out, I like to um, look at the whole scene and try to take one piece of the problem and improve it to see if we can create change because it's like we might not be able to quickly solve it right away, but you've had it. This is what we know so far. It's chronic. It's been there your whole life. They want to cut a nerve, and what they're trying to do is they're trying to disconnect the sympathetic nervous system. That's very dramatic. That's very drastic. Um, so, yeah, last week we told you some things to do. I think if it's that chronic, you're going to probably have to do them a little longer to see change. So what's happening, and if you study the autonomic nervous system, you're sympathetic dominant. So we have a problem with overactivity of the sympathetic nervous system. The sympathetic nervous system is located in two locations. Um, it's located in your mid back from T1 to T12, and it's also located in the inside of your adrenal glands. I would get the massage tool, work those out. You might not see change for 3 to 4 or even 5 to 6 weeks, but I would give it at least that time to do that. I would also um, see if there's any other issues that you have that you might need to support, like fix your sleep. I don't know, your digestion. If there's anything like that, I would do that. And it sounds like you're almost like your body is stuck in this on mode all the time because that's what the sympathetic does. It's flight or fight. It's kind of a stress response. And if you could maybe email me directly through my office any and all old triggers or traumas that you had, and that will help me to kind of figure this out. Okay.
Hey,
All
Doc.
right.
So
Hey.
we've got a couple of questions coming in from your studio from both YouTube and Facebook, and I've got one if you want me to field that now.
Yeah, I do. I want you to give me what we have on the social media. Give me a couple questions on that platform. That would be great.
All right, you got it. Okay, so first off, Fran from YouTube, and she wants to know if there is such a thing as keto surplus to gain hip muscle and glutes. So I guess they want to use this as a portion of their health and muscle gain program. So what can you supply them that might help them in that area?
Well, if we take a look at how to build muscle in general, what builds muscle, believe it or not, insulin builds muscle. And you say, well, wait a second, aren't we trying to lower insulin? Well, here's what we're trying to do. When you have insulin resistance, insulin becomes unavailable to you. And then the body makes more insulin, creating all this damage, but without getting the actual benefit of insulin. You have parts of your body are experiencing low insulin, like the muscle, and parts high insulin, which is creating all the negative effects. So this is why lowering the carbs, bring your insulin down to a normal level. It improves insulin resistance to the point where you can start utilizing that. So that's one thing. But the other thing, very importantly, is the increasing the growth hormone, human growth hormone, which also follows along of testosterone. They both work together, and they both help to build muscle protein. So how do we increase growth hormone? Using keto, healthy keto, because that drops the carbs down, and it drops, it actually will increase in growth hormone. But if we add intermittent fasting to that, we can really start to spike growth hormone up to 1,300% in women and up to 2,000% in men. That's what's going to help you increase the muscle density. So intermittent fasting can greatly help you. The other couple things is exercise, using heavier weights, strength training, with lots of recovery and lots of sleep. That will actually help develop the muscle versus, long distance running or low weight, lots of reps. Not good to build muscle mass. And then moderate amount of protein will also increase growth hormone. Vitamin D will increase growth hormone. And these are things that will help you. And there's amino acids you can take as well, but it's very insignificant. I think if you do healthy keto, intermittent fasting, with strength training, that's your best bet, and get a lot of sleep. Make sure your liver is healthy. What kills growth hormone and testosterone is the frequent eating and alcohol. Yeah, I'm sorry.
That's great, Doc. By the way, now Lori has one from Facebook. Lori, if you'd like to screen that one.
Hi, Dr. Berg.
Hey.
Alice George wants to know, how do you prevent warts after or other than cauterization?
Wow. Okay, warts. There's a lot of remedies for that, but it's really a virus. Warts are viral in nature. So if you have a lot of warts that keep coming back after you remove them, your immune system is overactive, and the adrenals, it could be the adrenals, but usually I like to support the liver, because a lot of times with the liver, you get these little skin tags and warts and brown spots and red spots, and you get all these things. So what I would do if I were you for the best wart handling would be intermittent fasting at least 20 hours. Okay, 20 hours, because when you do intermittent fasting, you put your body into a state of autophagy where you're recycling the proteins, but you're also recycling and cleaning up old fungus, mold, bacteria, and viruses. That's what I would do if I were you. I'm not going to say that your warts are going to fall off, but I'm going to say that they'll probably not come back, and they probably will improve the growth of warts. But think about their viruses. You can't kill viruses. You can only put them in remission. And they kind of come out in remission during times of stress. That's why you get the herpes after a stress event, shingles after a stress event, canker sores. Those are all viral in nature. So if you keep low stress, that will also help. Great.
Okay, Doc, so maybe one more before we go back to the calls. And this must be a company on YouTube, Baloma Arts, and it's something you talked about earlier, keto for gallstones. So maybe you can recap a little bit about that, how they can help gallstones through keto or whatever recommendation you might have?
Good question. Because what is a gallstone? A gallstone is a stone in the gallbladder, and it's obstructing the bile flow. Gallstones are created from low bile, a lack of bile that's being produced by the liver. So now the question is, what will increase bile? Well, guess what? Saturated fats increase bile. To helps keep stones from being formed. Well, what creates stones? High insulin. That's why a lot of diabetics get stones. So really, by doing ketogenic fasting, you're actually going to prevent stones and shrink stones, but you're going to have to add some more saturated fats in the diet. And also, another thing is just pure bile salts. And I like to take my gallbladder formula because it helps. It doesn't just work on the symptom, it works on the whole digestive system. You take them at one after a meal. It's called gallbladder formula, and you will help to break down those stones. There's also like some other things in that formula called stone root, betaine hydrochloride, and things to help really hitting it from all sides. Now, when you don't eat so frequently, you let the gallbladder have a chance to recycle and to concentrate the bile by a factor of 20x, which is now we increase the bile concentration. Now we can really get rid of the stones. If you eat so frequent, which we don't recommend, you keep insulin spiked and you keep the stones there and you create stress in the gallbladder. So the combination of what we're talking about, healthy keto and intermittent fasting, is wonderful for the gallbladder, especially if you don't have a gallbladder, especially if you have stones. All right, Steve, how do you like that answer?
Oh, fantastic. If I had him, I'd be absolutely
What's your
thrilled.
question?
Okay, good. All right, so let's just go to Marty from South Carolina had a question about electrolyte powder or wheatgrass powder, or do these break up fast? Go ahead, Marty. Are you there?
Yes. Yes, I am. Thank you. I've heard differing opinions on this, and I know you will know the real answer. Is your electrolyte powder or the wheat juice grass, does it break a fast?
Yeah, good question. This comes up a lot. I should probably create a video on it, and the long answer is no. It won't. First of all, there's hardly any calories in either one. Like even the wheatgrass juice powder, if you have one scoop, it's 1 calorie. So it's a concentrated juice, but it's not sweet. It is less than 1 gram of carb. So because it has all the nutrients and chlorophyll. The electrolyte powder has no sugar, no maltodextrin. It's just minerals and a pinch of stevia. So those won't bump your fast or get you out of that fast, and they won't, and even supplements in general won't do that unless it involves protein supplements, that will, but those won't at all. Thanks, Marty.
Awesome.
Hey,
Wonderful.
let's go to Ken from Texas. Ken's been waiting for a period of time. Go ahead, Ken, you had a question.
Yes, I wanted to ask about liposomal vitamin C.
Yeah.
I know you commented that ascorbic acid is not that good, and so it seems to be made from ascorbic acid or the, I guess, the buffer form of ascorbic acid. I forget what it's called now. And its effects on concussion and also on skin issues such as basal skin cells, warts, skin tags, these kind of things.
Good question. I do like liposomal vitamin C because it has what they did is they add something called a phospholipid ingredient, which is you kind of make it fat soluble, so it can innervate deeper into the cells, and because your cells have a double wrap layer of fat, and this can kind of go right through. If we take vitamins, you have 2 categories. You have the water soluble ones like vitamin C, vitamin B, and then you have the fat soluble vitamins, vitamin A, D, E, and K. What's unique about the fat soluble ones, and even if you turn the water soluble into the fat soluble, they allow these vitamins to penetrate the cell wall, to go deep into the DNA to create some really cool effects. But the water soluble vitamins never penetrate the cell. So that would be the difference, and I think it would be good for you to take that. But make sure that you don't, at the same time, omit all the foods that are high in vitamin C: bell pepper, sauerkraut, cabbage, all the leafy greens, very vital. Even like sometimes I'll have a bag of snap peas. I'll down the whole thing. Talk about vitamin C, great complex, and even don't look at like the always the total amount of vitamin C. Look at the completeness of the complex, and that's why food is the best, even though it's not comparable to the synthetic. You take it, and all those factors work together very effectively to help you with the vitamin C, which is good for gums, bleeding gums, connective tissue, that type of thing. All right, thanks, Ken.
Is sodium
Okay, you broke up. I think you were going to say is ascorbate okay? I have a video on that. Make sure it's non-GMO. It's good for temporary things if you want to boost your immune system, but make sure you don't take it long term because it's going to deplete you sometimes of the other factors of the vitamin C complex, and you may end up with a loss of copper and like I've had people weaken the adrenals by taking too much synthetic vitamin C because a lot of the vitamin C is stored by the adrenal glands. So that's one way to weaken an adrenal. But you need the complete complex to support the adrenal. And believe it or not, one of the good sources of the complete vitamin C complex is organ meats. Yeah, interesting. All right. So let's go to the next caller. I think it's going to be Julie from Michigan, if I'm not mistaken. I'll let me know. Steve?
That's her, Julie from Michigan.
Hey, Julie.
Hello, thank you. Hi, Dr. Berg. Thank you so much for taking my call. I've been wondering if you have any advice for settling a queasy stomach that would be healthier than reaching for crackers or ginger ale. I've been kind of leading a low carb lifestyle for about 2 years. I've learned a lot from your videos, but my downfall is I get motion sick really easy. I have that tendency to get a queasy stomach, and then I want to reach for crackers or toast or ginger ale, and I'm just wondering if there's a healthier way to settle that.
Sure. I have a question. Do you get motion sick when you're driving or other ways?
Usually if I'm a passenger on a long car ride or a ferry boat, or even sometimes just waking up in the morning, like I can't, I just have that tendency to get that queasy stomach.
Okay. Yeah, okay, so here's what you need to do. Ginger tea, ginger supplements are really good to settle the stomach down. And also artichoke leaf is a vegan alternative to bile salts. Artichoke leaf is another good thing to calm down the stomach, allow the bile to flow, prevent nauseousness, that type of thing. But the other thing you can do, realize that if you're getting queasy, you could manually, if you don't have any supplements and you're in the middle of a desert, take your hands and start massaging the gallbladder and the pancreas, and you'll actually get rid of it like that. And I have videos on gallbladder flushing manually using your hands. But yeah, the best thing would be ginger tea, or the supplement, and that would calm down the stomach. And then when you're in the back seat, make sure that when they're driving, you're looking forward as much as you can. Don't look to the side. Look forward where the car is going, and that will help to kind of stabilize your nervous system so it doesn't put the nervous system in a confusion. Okay?
Okay.
All right. Thanks, Julie.
Thank you very much.
All right. Hey, let's go to Derek. I haven't heard from Derek in at least a week. Hey, Derek. How you doing?
How's everything?
Good.
Hey, Dr. Berg, I have a problem getting thrown off of my keto and IF. It has to do something with the acid reflux that I've been dealing with. And whenever I go long periods of time without eating food, that's kind of when the acid reflux stops. It's almost like my stomach acid gets depleted, and then the whole situation starts.
Okay. Yeah, and I think you also have itching in your foot.
Yeah, I've been dealing with some itching in my feet and shins actually, and I also have like basically nerve pain And this kind of started when I started to sit down for about 18 months straight with the job that I was doing. It was behind a computer, and I would literally basically be sedentary the whole time for about 18 months straight. And that's how a lot of my problems actually started.
Yeah, yeah, I hear you. It's a lot of sitting will really create a lot of nerve damage in your lower back. I did a video recently, and this is just a side note. If you take a foam roller like this and you put it in the very lower part of the spine and scoot back, and you push your coccyx and sacrum, that's the bottom of the spine, and have it so it's rocked forward, and you have the pelvis that rocks forward. You'll keep the curve in the back upright, so you're not sitting back like this, and that will actually take a lot of pressure off the nerve roots. Now, a couple of things. We keep coming back to this acid, and yes, you're taking this, you're taking all these remedies. There is, if we look at the cells that make hydrochloric acid, store hydrochloric acid, they are controlled by a hydrogen / potassium pump. So one of the key things is potassium. And by getting a lot more potassium, that pump can actually then work effectively. I wonder if you have intracellular potassium deficiency, there's a test that you can do, because you can't check the blood. It doesn't, because most of the potassium is inside the cell. And if you look up intracellular potassium testing, you can get a home kit, take a scrape off your skin, they can look inside your cells and see how much potassium. It'd be very valuable to see if there's how much is in there, if you're deficient. If so, then we know we're going to have to build that up over the next several months, which then will probably solve a lot of your problems right there. But yeah, potassium is important. I know you're already probably taking choline, which is good for the liver, which is good for itching, because if you're backed up on the bile, that can also cause itching. So that's what I would recommend, Eric. Try that, and then let me know how you do, okay?
Thanks, Dr. Berg.
Hey, you're welcome.
Hey, Doc, we've got some more social media action if you would like it.
Yeah, I do want to know what's going on social media if you guys have any questions.
Of course you do. Okay, so from YouTube, we have Sarah, who has had a kidney transplant, and she wants to know if keto is safe for those with such a procedure.
Yeah. Okay, so here's the thing. If you have a kidney transplant, you're going to be on probably prednisone or some other steroid as an anti-rejection drug, and there's other ones as well. And so you definitely need to do keto and intermittent fasting to support your immune system. But this is the false information. Like, they think that, oh yeah, I don't want to do that because I don't want to stimulate my immune system to create more antibodies. It's not going to do that. All you're doing is you're strengthening the immune system. We're not over making more than you need. So that's not going to do anything. But if you don't do keto and intermittent fasting and do the typical diet, that's not good for the kidney, because if you think about what kills off a kidney is high insulin. Regulating insulin is the absolute best thing you can do to support the kidney, and do it healthily with a lot of vegetables. What also you want to focus on too is not going too high with your proteins. Moderate proteins, 3 to 6 ounces, not more than that, to support that kidney. Make sure your uric acid levels are good, so make sure you do a lot of vegetables, potassium from the vegetables to support that. And the problem you're going to run into is the protecting the body against that prednisone, and that's really is what you're going to have to do damage control on that, because you have to take it or your body will attack that new kidney. And it's like supporting the adrenal, colostrum is good, eating really healthy, and just keeping the other parts of the body really, really robust. Now, the last thing I want to mention, if you have a stage 4 kidney problems, and then that's something completely different where you can't consume too much potassium and certain elements. Well, okay, fine. Just don't take any supplements, but just start eating healthy and you're going to be fine. I've had people have severe kidney problems come back from just eating healthy and putting in intermittent fasting, which actually helps recycle the proteins. So that's what I would do.
Okay, Doc. Now, Lori has some terrific questions from Facebook. Lori?
Melly A. Neff wants to thank you for providing these live informationals, and she wants to know if you would suggest carb cycling.
Right. Yeah, that keeps coming up. You know, okay, I understand there's people like carb cycling because they like carbs, and I know this is hard to believe, Steve and Lori, but some people can't be perfect 100% of the time. I know that's shocking.
What are you intimating, Doc?
So what you got to do is realize that you're working towards the ideal perfect situation, and it's a gradual effect. You want to keep getting better. The key is look at the trend. Are you doing better, or are you kind of cheating and you're not improving over time? If you can look in the past and go, yeah, hey, listen, overall I'm better than I was last week, then okay. But the whole cheating, not cheating, but the carb cycling, going off keto, it's not going to help you. It's not going to help you. We don't need carbs. Those refined carbs. We need vegetable carbs, but we don't need carbs. It's not going to replenish our glycogen reserves. Our body has the ability to make sugar from protein. It's called gluconeogenesis. Our liver can do it. We don't need to take extra sugar. So we don't need to recycle. It's not going to help you. Now, it's going to make you feel better temporarily if you have low blood sugar, so you're going to think it makes you better, but it's going to knock you out of keto and you got to get back into it. But it's not a beneficial thing. It's really not. The best thing to do is to get into keto and healthily and then fully adapt so you really feel what it feels like and you don't have any more blood sugar problems. That being said, once you do keto and you have this new level of health reserve, okay, then you can afford to go off of it if you want. You can eat, here and there. That's fine. But that way you can get right back in it. But it's not going to be something that is going to help you, but you'll be able to afford not being perfect once you have a health reserve. All right, Steve?
Okay, that's great. I think we should go back to the phone calls.
And I'm guessing that you probably you just asked that from you, right? There was no question, right?
No, I'm asking for a friend.
Oh, a friend. Okay, yeah, I believe that, Steve. I totally believe that.
Yeah, look at our physique. I mean, it's obvious that I've been strict just as much as skinny out there in the studio, so I don't know what you're talking about, Doc.
Steve, I think you should follow the ribs, the Beyond Keto zero body fat plan. I'll get you on that real soon. Okay?
Will do.
All right. Hey, Michelle from Virginia, you had a question. You had a confusion about some of the supplements. Go ahead, Michelle.
Can you hear me?
Yeah.
Okay, great. Hi.
Hi.
So I am purchasing or looking to purchase I wanted to get back to your shop because I was looking at the supplements there. The cauliflower, I'm going to list off the ones that I'm interested in. And I'm scared I'm going to take too much of something. The adrenal and cortisol support, the D3 and K2, the sea kelp, the whole cruciferous food, the sleep aid, and the trace minerals.
Okay.
Those are the ones that I'm interested in. But I've read that you're not supposed to have more than 150 micrograms of iodine.
Got it. Okay.
I don't know if I see there's iodine in the cruciferous and in of course, the sea kelp. And I just don't know if I'm overdoing it with all those combinations.
Okay, that's a good question. What part of Virginia are you from?
Virginia Beach.
Ah, okay. So you're about 3 hours away from me. The good thing about that question is that you don't have to worry about it because it's in a form of a sea vegetable. It's all sea kelp. There's no added iodine from any type of elemental source. Like elemental be like non-plant based. So these are all plant-based or vegetation sources, and they're in small amounts where your body can deal with them easily and there's no way you'll actually even have close to even getting up to a toxic level or anything like that. So no, you have nothing to worry about. There's from sea kelp, and they're pretty small amounts. Even the one in the cruciferous, it's a small amount. And in the trace minerals I have, those are all plant-based, and they're also in micrograms. So nothing to worry about, Michelle.
Can I ask to clarify then, if the iodine is plant-based, then you don't have to worry. You can have unlimited amount.
Well, you can't have unlimited, but think about this: if you're gonna take, let's say, sea kelp, right, which is seaweed, and you think about eating
and that has
seaweed.
500 micrograms, right?
Well, it depends on how many pills you're taking. I think mine's a lot smaller, because if it's 300 milligrams, the amount of iodine is much, much, much less because we're dealing with the whole vegetable. So the question is, how much seaweed could you eat in one sitting? Your body's going to say, oh, I had enough of that. So anytime you consume either sea kelp or seaweed, as in like, I don't know, like sushi or something, you'd have to consume a lot of it to have a problem. So if you're just taking one pill a day, nothing to worry about. And the other thing too, the only time you wouldn't want to take this is if you were a hyperthyroid case, which I don't think you are. So I think you're pretty much safe on that.
I had a hyperparathyroid, but I know that that's not related to the thyroid.
Yeah,
but,
that's completely different. And you would know it if you have a hyperthyroid. Your eyes are bulging out, high pulse rate. But the sea kelp is really good to support your estrogen levels, support your thyroid, and then also I always recommend take it in the morning because it can give you energy and then keep you up at night if you take it right before bed.
Okay, so those 5 supplements all together, there's not too much overlap of anything.
No.
Okay, and then my last question is, how much nutritional yeast should you have per day?
Yeah, if you're taking it in a tablet form, I would do, if starting out, maybe try to shoot for 6 a day. If you're maintenance dose, 3 a day. If you're taking in a powder, I would take 1 to 2 heaping teaspoons. It's hard to consume it like that, but it will help you. But those B vitamins will counter stress just like that. They'll melt the stress and you'll feel really good. All right, thanks, Michelle. All right, so we're going to go to Florida next with Miroslava. And I probably chopped your name up pretty good. Hi.
Oh, no, you're fine. You did it. You said it pretty good.
Okay, good.
So I am calling. I actually called last week. I couldn't get a hold of you. But my concern, I do suffer from hypothyroidism. And I've been taking medicine for about 3 years.
Okay.
Both levothyroxine and liothyronine. Okay. And I've been doing keto for 3 weeks, and I had to go down because I was getting very jittery. So I know it's working, right? I don't really need a lot of medication. Right. But it seems like I get a little hypoglycemic too when I skip meals. And I've been trying to get into the fast, to do just the 2 meals a day, but I can't do it. I can't do it. And I've been doing it for 3 weeks, and I try one day, and the next day I'm very weak, and my heart is racing a little bit, and I get a sweat too. So I know that it's my sugar going down. So I go ahead and eat something. I had to eat my meals. I don't snack. I just stay with the 3 meals.
Okay.
And I noticed that the scale doesn't go down. It just always go up and down the same half a pound. So I've only lost 2 pounds on this. Okay. That's it.
Is your clothes feeling looser yet?
Oh, yeah. I can see my body changing. I can see my stomach going down. I'm 131 pounds. Of course, I need to go down to 122. That's my goal. I don't know how long it's going to take me there, but I do want to get better because I had a lot of pain everywhere in my body after my accident. So a lot of inflammation in my body. That's why my doctor said, you got to get on this. And guess what? I had no pain ever since I've been on this. Just a little discomfort here and there on my back, but no more
Awesome.
burning. That's the big deal for me. Big deal.
Yeah. Okay, good. So let me kind of go through some things, okay? And I'll have the producers put you on pause. So when you're doing keto, you want to focus on getting healthy first, and that's where you're at. But you are getting healthy because the indicators of health are not just weight loss. It's clothes size, it's decreased inflammatory conditions, your energy should be going up, the need for medications are going down. So you got to get with your doctor. But just realize that if you have low blood sugar and you're trying to stabilize that, think about what's happening. You're dropping insulin, right? Now, when the blood sugars go down too far, that means that your adrenals are weak and they're not able to stabilize and bring them back up. So you need to support your adrenals for hypoglycemia. And I'm assuming that you're doing this correctly with the right eating plan that I recommend from here. And that would be lots of salad, increase your fat till it go from one meal to the next. Those two things are vital if you're having a hard time going from one meal to the next without dropping your blood sugars. Increase the potassium from the vegetables, increase the fat. But if you're doing that and you still have a problem, you need to support the adrenals. So watch my videos on that. I have the cortisol support is great to support the adrenals because the adrenals are really the factor if you have hypoglycemia or not. Okay? But I think it's working. You just need to tweak it. All right. Thanks for your call. Hey, let's go to Marty from South Carolina. I had a question about electrolyte powder, or did we answer that yet, Marty?
Yes, we did answer that. Thank you.
Okay, great. Thanks. All right, so let's go to Alex from Texas. Intermittent fasting, ketones are going up and down. Go ahead, Alex.
Hi there. Good morning. How are you?
Good morning. Great.
So yes, I have a question regarding that. I'm new to keto diet, and I have been doing the intermittent fasting, and I do between 18 and 19 hours a day, where I don't eat, and I eat 2 meals, and I don't snack. And I've recently started measuring my ketones via blood, and I noticed that they're just totally out of whack. I mean, I had a few days ago they were like 1.4, and then yesterday 0.4, and then this morning was 0.8. Is that normal, or is it something that I'm not watching out for that I should?
So let me ask you this. Are you experiencing any benefits from doing this, body-wise?
Yes, I'm feeling good. I'm getting a little bit hungry when it comes like 2 hours before my intermittent fasting is supposed to end. But besides that, I'm feeling good, and my weight is not, it's going kind of down and then up and then down again. But I'm kind of sticking with it because I noticed that overall my clothes are fitting more looser, so I am losing some around my tummy. So it's working.
Good. Okay, so I'm going to show you something. So you probably see this out of this book here. So as you're doing this, you're improving insulin resistance, okay? So your insulin is coming down, 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 and then the first thing to show up is your waist should be coming down. That means it's working, way more than weight loss. Now, the ketones are tricky to understand them because think about it. If your body is using up this ketone as a fuel, they're going to go down. If they're high, your body's just kind of wasting them, and it's kind of going through the system. So I would look at ketones as, put it like a grain of salt. Like they're just not as important at this point. What's really important is your clothes size, your energy, your tolerance for stress, your memory, your cognitive function, your mood. That's the thing that I would look at. Now, let's say, for example, you get hungry 2 hours before the next meal. It's okay to be a little hungry because now your body is still adjusting. It's okay to be a little hungry because we want you to eventually get to be hungry and then eat versus never hungry. But I think if you go back through, make sure you're doing everything by the book, moderate protein, keep your carbs down. If you want to speed things up, bring the carbs even lower. Make sure you're not cheating and nothing else in there. And then adjust the fats. So if you do a little too many fats, that's going to also stop your progress. So I would also watch that. But I think you're right on track. I would ride the wave, give it more time, make sure you follow these points, and I think it's going to get better because it does take some time to get into keto fully. All right.
Okay.
Thanks for your question. Yeah.
Okay, thank you.
Okay. Sure. All right. So then we have the next caller, Steve. Who we're gonna talk to? Are we gonna talk to Patrick or Darcy?
Let's see, let's do Patrick since he's been patient for almost 8 minutes.
Okay. Hey, Patrick.
Hello. Hi. Can you hear me?
Yes. Crystal clear.
Hi, Dr. Berg. One of your biggest fans. Can I have your autograph?
Absolutely. Let me sign off right now.
Fantastic. Okay, cool. Yeah, I just got two quick questions really, and it's regarding the Atkins diet versus keto, and my second question would be regarding carbohydrates. But so my primary question is that is it okay to dabble between doing the Atkins diet and the ketogenic diet, or would they interfere with each other? Because I know that the Atkins diet is predominantly high protein, whereas the keto diet is predominantly high fat.
Yeah. Well, there's a couple things about the Atkins diet I did a video on this. The problem is that it increases more protein. So you have higher amounts of protein, which can, if your liver isn't that great, if you're doing 3 meals or even 2 meals and you're doing high protein, might not be a good idea because you're going to spike insulin a little bit, and it can actually slow down your progress. But if you're doing 1 meal, you can increase your protein a lot more because you're just doing 1 meal and you need a little more protein. So it really would be dependent on what you're talking about. But there is a problem with going too high with the protein because you're going to stimulate insulin and create a little stress in the kidney and liver, and that can create ammonia and uric acid and all these other things. So that's my point on that. And also the problem with the Atkins diet is they allow the certain type of sweeteners like maltose, and I don't like that one because it's almost like it can really spike your insulin. But as far as the protein goes, I think you're going to find that you're going to do best on a moderate amount of protein. And then I think you had the next question was, what was the next question?
So my last question was regarding so intermittent fasting. But before I divulge, it's literally my satiety levels have gone down. So since I've been doing the ketogenic diet, my satiety levels have been going down, decreased. So my hunger has decreased like tenfold, and I'm down to like literally 2 meals a day. I'm very active as well, so I go to the gym every day. I do catabolic and anabolic training. So my question really is regarding: would it be okay to do, for example, 5 to 6 days of eat keto foods, and then maybe have a carb day? Would that really? I mean, would it be harder for me to get back into ketosis doing that just 1 day of eating carbs?
Yeah, I think if you could stick with it, I think your performance will be much better long term. But I hear what you're trying to do. I would not add the carb day in there, but realize that you could have a little bit of berries in here and there, so that's not going to be a problem. And the other thing is if your hunger is going way down and you're working out, you could probably get by with a little more protein. I would also do an electrolyte powder for more performance with your muscles, and I would also add something called cordyceps. Cordyceps is a kind of a mushroom fungus that's from Tibet and China, where you can actually greatly improve the oxygen carrying capacity in your muscles, and you can get better performance. So that's what I would do if I wanted to squeak out more improvement on your exercise. Thanks, Patrick. All right. Darcy from Texas has a question. Go ahead, Darcy.
Hi, Dr. Berg.
Hi.
I have really bad anxiety issues, and I am taking some supplements to help me with that, and they're yours, of course. And I'm I'm not getting much relief still, and I'm doing keto, probably not as strict as I should. But I was wondering if there was anything more I could be doing.
Yeah, well, are you taking, what supplements are you taking?
The adrenal formula. I'm taking wheatgrass juice.
Which formula? Which adrenal one? Is it cortisol relief or the the adrenal fatigue formula?
Oh, let me look. I didn't know there was more than one. It's adrenal and cortisol support.
Okay, good. And then as far as the anxiety, does it come and go, or is it always there?
It's always there.
And is it in your head where you're thinking a lot, kind of worrying, or is it in the whole body?
No, it's body symptoms. The mornings are way worse, and I just feel kind of like a cartoon. I don't know how to explain it. Sometimes very off balance.
Okay.
It's just scary.
So you get a little dizzy when you stand up?
No, it's not like dizzy from low blood pressure. It's not like that.
So is it worry, or is it just instability?
It's instability.
Oh, okay.
Mm-hmm.
So it's really not anxiety. But it just
Is
worries
it my
you because
reaction
you're
to what's happening?
It's more like a physical thing than a mental thing.
Okay.
Right? I mean, I'm just asking.
Well, I don't know. When that happens, I tend to panic.
Okay, got it.
Which probably makes it worse.
Yeah. Okay, so I think there's one more thing that I would do. I think the keto intermittent fasting, if you go a little more strict, is going to help you. I really do. Just make sure you're adding a lot of vegetables and sea salt. That's going to be very important. But the other thing I think you should get, and it's called my nutritional yeast tablets. If you don't already have them, and take 6 of those a day, I think that will probably give you the most stability. And then if it's from some weird reason that doesn't solve it, send a communication to my office with a little background of your history to see if there's something else that we're missing. Okay, Darcy?
All right, Doc. Well, it looks like we're pretty close to the end here, and we've run out of questions. We truly miss Karen and her great elegance on camera, but we hope we have filled in appropriately. By the way, very sad event. You'll notice, or the audience will, that Slim died during the show. I'm so sorry about his passing.
Darn it, I hate that when that happens.
Oh, I know, it's terrible. And we'll go back to you. And then if you can just close up for us, Doc, we're going to fade off very unceremoniously at the end.
Okay. All right, guys. Hey, thanks for your calls. Thanks for all your attention. Thanks for watching the videos. I appreciate you guys. Have a great weekend, and we will see you next week, probably from the same location. All right. Have a good one.